Hello everyone. So in our last session we learned about the accurate calculation of gestational age by first trimester menstrual history and ultrasonography, and we all learned that it is the best time to calculate gestational age and assign estimated date of delivery if we do it in first trimester using a ultrasonography and menstrual cycle history. And once we assign the EDD in first trimester using both of these methods, we do not change it later on. The EDD would remain the same, right? That is a very important thing to learn. We also got to know that the variation in gestational age, if we have calculated it in first trimester by ultrasonography using CRL measurements, then the variation is only 5 to 7 days. If the sonography has been done before 10 weeks, the variation would be even less than 5 days, that is 3 to 5 days. And if the sonography has been done beyond 10 weeks till 14 weeks, the variation would be less than 7 days, that is 5 to 7 days. So first trimester is the best method to assign EDD to a pregnant lady. But what if a pregnant lady comes to you in second or third trimester who doesn't remember her menstrual history accurately and is not sure of her last menstrual period? What you are supposed to do then? And it is not a very uncommon condition. It is very common in a country like ours to see a pregnant lady in second trimester and third trimester directly who is not aware about her menstrual cycle or doesn't remember the last menstrual period exactly now, because the time has been long now, right? So it is upon us to accurately calculate her gestational age now, because our decisions are going to be affected if we do not calculate the gestational age accurately. So it is upon us only. So in second trimester, and that starts from 14 weeks and lasts till 28 weeks, there are certain USG parameters which we use to calculate gestational age, like BPD, biparietal diameter, FL, female length, and abdominal circumference, that is AC. A combination of these is used to calculate gestational age in second trimester. But the variation in gestational age that we calculate in second trimester depends on whether the sonography has been done in early part of second trimester or later part of second trimester. If it has been done in early part of second trimester, like from 14 weeks to 22 weeks, then the variation is lesser. Then the gestational age that we have calculated by USG is more reliable than if it has been done in later part of second trimester, where the variation increases to more. Like if it has been done before 22 weeks, the variation would be 7 to 10 days, right? But if it has been done beyond 22 weeks till 28 weeks, then the variation increases to 14 days to 21 days. It may increase up to 3 weeks or at least 2 weeks. So which is a big time to decide for certain conditions later on. So and also in later part of second trimester, fetal growth disorders start appearing, right? So they may affect the calculation of these ultrasonography parameters. So the next best time after first trimester to calculate gestational age accurately would be early second trimester, that is from 14 weeks to 22 weeks. Then then there is a very common thing that a lady in our setups come directly in third trimester who doesn't remember her cycles at all. She has forgotten her LMP now, and then we are the one who are like, what to do now? She could be a case of fetal growth restriction. We may calculate the gestational age wrong if we only go by her clinical history and clinical examination. So we need to be near the actual gestational age to manage those kind of cases. So what are the ways to calculate gestational age in third trimester? In third trimester also we use the same ultrasonography parameters that we use in second trimester or late second trimester, that is BPD, AC and female length. The combination of all of these, it is a Hadlock formula which we all have been using to calculate gestational age in second and third trimester. So that is what we use. But the variation in third trimester increases. It increases up to 3 weeks. Right, and at times if it has not been performed nicely, in the variation may increase to even 28 days, 4 weeks, 3 to 4 weeks, which is a huge time to decide about certain conditions in pregnancy. So and also here also fetus may be having this IUGR growth restriction, so that would affect the calculation of your gestational age. So there have been studies on use of a particular parameter on ultrasonography which is more reliable, and it would be best if it is not affected by the growth disorders of fetus. So there is one such parameter, although out of these three, femur length, BPD and AC, femur length is the one which is least affected by fetal growth disorders. So it would be still a better parameter to calculate gestational age by femur length in third trimester. But its accuracy is not has not been found to be that much good. So people have been studying on one more parameter, that is transcerebellar diameter. It's been 20-25 years now when it was first started. Was first used in various studies, if it can give us a good idea about the gestational age in third trimester, because it is least affected by fetal growth disorders as per studies. There is a very good study published in Lancet in 2020 that tells us about the utilization of transcerebellar diameter in calculation of gestational age in later parts of pregnancy. And they found that the variation in gestational age is only maximum by 2 weeks, 14 to 16 days, and in most of the cases the variation was only 7 to 10 days. That is so it is found to be as good parameter as in a second trimester we use the other parameters. Right, so if the transcerebellar diameter, especially if it is used in combination with femur length, it can be of a very good value to calculate gestational age in third trimester. It would be still a reliable method to calculate gestational age in third trimester. So we all know that in our MD courses all residents are learning sonographies, obstetric sonographies, but we should start using these new parameters also. It is no more a new parameter, it is a commonly used parameter, so we should include this transcerebellar diameter calculation measurement in our routine practice, especially if we are doing it and we are doing the sonography in second and third trimesters. So I hope we all would be including this measurement now onwards, and the benefit of using it for calculation of gestational age in third trimester would be passed on to patients also. Thank you so much.